At least 58 hospitals have been severely affected following the floods in KwaZulu-Natal. Some hospitals have been partly flooded, while others have suffered roof and floor damage. Most of the affected healthcare facilities are in the eThekwini, Ilembe and Ugu districts, amongst others. Health officials say there has also been a significant increase in the number of emergency and trauma patients. Close to 400 people have been killed in the province and scores others injured. Damage to infrastructure is also impacting on operations at many facilities. 14 hospitals are currently experiencing water shortages. Let's take this story further now. We are joined via Zoom by the head of Department of Health in KwaZulu-Natal, Dr Sandile Tshabalala, to weigh in on the KZN Floods developments with regards to the hospitals. A very good afternoon to you, Dr Tshabalala.
Well, afternoon. I do not know the good part of it under the circumstances.
Absolutely.
But good afternoon.
Absolutely. And as you say, a lot of damage was caused by these floods. I mean, at the moment, we're sitting at, just close to 400 people that have lost their lives. Take us through the damage that your hospitals have suffered, putting into context, of course, the 54 hospitals that we are talking about and reporting on that have been affected.
No, thank you for taking the story. Look, as the province of KwaZulu-Natal, the damages are not only on the hospital infrastructure, but there is so much damage even around the infrastructure generally, including the roads, and therefore the access to even the hospitals that are not much affected. But if you look into the hospitals themselves, or even our clinics, the impact is mostly on the roof leaks, but the one devastating part is the flooding and mudslide into the floors of our institutions. And that is what is making it difficult for us to immediately resume work. But we already have started to assess the cost, to assess the needs, and also see how far we can do to go back to normality.
So we know that there is water shortages as well as electricity problems across the province. Of the 14 hospitals, we know that there are water shortages there. Talk to us about the impact that this is causing.
Obviously, water shortages anywhere would have devastating challenges in any health system. We have had challenges in hospitals, particularly in eThekwini. But I think we must thank the government. And when I say government, I'm talking national government, provincial government, and municipal governments, because all three tiers are working towards making sure that there is water, be it in one of the hospitals that was devastated, Prince Mshieni Hospital. Water is either being sent there using water tankers, but also the reservoirs are being filled so that at least water is there for a period of time. And that we are assisted by the municipalities. Of course, Kokcha nationally and Kokcha provincially are doing the best to assist with the department being just a receiving part of this. And this is not only done to the Department of Health, but to all the sectors that need water. And I think we are finding some space, and we are able to do something about it.
Now, in the affected hospitals, how are you dealing with the patients that are admitted? We know that, of course, in those three areas, eThekwini, Ilembe and Ugu districts, there's a significant increase in the number of emergency and trauma patients. How are you dealing with that, particularly in those hospitals that you say are damaged or affected somewhat?
Look, we've devised a strategy that says we are going to be very meticulous at our outpatients units. Where a patient does not need to be admitted, we're not going to admit those patients. Where a patient is stable enough to be discharged home, we will discharge those patients. But where a patient needs to be in the hospital, we do everything possible for that patient to be seen in that facility. If needs be, we then move that patient to another facility so that the quality and the efficiency in terms of care is not compromised at all. So we have all those systems in place, and so far we have found them to be working. We are satisfied with them, but we are looking at loopholes where they can come. We just are worried about the clients who are supposed to come pick their medications in our CCMTD points who do not have access, and those who do not have access into some of our clinics. That's why we are worried more. But in our facilities, we think we are managing, because even operations are happening. If needs be, we move even staff from one place to another.
That is concerning, particularly if you consider that some of those medications could be for, chronic patients or other people who have more serious illnesses. Another thing that's worrying is what the weather department is forecasting for this weekend in KZN. How worried are you that that will have further impact on those hospitals that are already struggling?
Well, we're very worried. As you catch me being in the car, it's because I'm from at least 3 of the centers that I wanted to go check where we had some damages. Now, when you think we can start working here and start repairing there, and the weather comes back with a rain which is going to disturb us, it delays us even further. So we're worried about that, but we are hoping that, as predictions are saying, from Tuesday onwards, we're not going to be seeing devastating weathers, and we will then start to repair our clinics, repair our facilities as quickly as we can. The process has already started, because we still have to adhere to the SCM, that is supply chain management regulations, and all those rules to make sure that we are doing things correctly. But we've started that process, hoping that when Tuesday everything stops in terms of the rain, we will just be continuing with processes that we are now implementing.
Just another concern, we are still in the pandemic, and we know that there is this threatening, looming 5th wave that is coming as a result of other variants as it relates to COVID-19. How worried are you that, should this 5th wave hit, that you will still have problems in some of your facilities, particularly as it relates to your healthcare workers?
We are worried about our healthcare workers as much as we are worried about the community. Remember, our healthcare workers will find themselves being unable to navigate their way home, navigate their way to work as well, and as such that will create some anxieties among them. Secondly, some of the people that will be coming in will be coming as emergencies, and the ability to screen them correctly will not be that good. Thirdly, some of the people that would have been moved by government to halls and wherever else that people can be accommodated may go there not being screened. Even if you screen them, you are not going to easily separate them from each other. And therefore, we're worried not only about COVID, by the way. Remember, floods can also come with some diarrheal diseases and other diseases that are infectious, with people conglomerating in one space. So we're worried about the post-floods issue. We think the post-COVID, if there is anything like post-COVID, plus the post-floods issue, will say to us we must be even more efficient in terms of managing all the people that are coming to our facilities, whether private or public facilities. Will have to cooperate and collaborate in managing the situation.
Just talking about those flood-related illnesses, do you then have mitigating steps in place, particularly as you fear an outbreak happening in one of the hospitals?
We already have advised people that they will be having challenges with water, and therefore the water they will get, they at least must boil it before they use it. They must use jig on that water so that it's clean water. This is trying to prevent the diarrheal diseases. But also these messages will continue to be shared with the community, either through the Office of the Premier, because at this hour, it is the Office of the Premier that is coordinating everything in the province, and therefore messages will come from time to time. Also, we will be asked to share whatever, but we'll be guided by that. Remember, some of the people will not be having even enough money to go and buy food, and therefore that assistance will have to be coordinated very well, and the Office of the Premier is doing that in our province. But we are doing everything to be preventive in our approach.
Dr. Tshabalala, as the head of the Department of Health in KZN, I mean, we're told that these particular floods are of a larger scale than what we have seen in the past. And of course, if you bring in the issue and the element of climate change, it becomes even more worrying. In your personal capacity, have you seen anything of this scale before?
2017 was not good. When we look at the damages, we feel it was bad. But having been around the parts of the province and having seen the devastating effects or the impact on the community, particularly those communities that have built their places of stay next to the banks of houses, it's been really, really depressing, to say the least. But we are encouraging our people to really go for counseling. We're encouraging them not to go back and build their houses in those areas. Let them communicate with municipalities and make sure that life is much better out after this. This is bad. Even if these were better than the floods that have happened before, the fact that we've lost so many lives makes it one of the most devastating incidences in our province.
I can only imagine. Well, Dr. Tshabalala, thank you so much. We really appreciate your time this afternoon.
Thank you. Thanks a lot. Thank you.